Good morning, ladies and gentlemen. Today, I'd like to share our achievements in reducing mother-to-child transmission of Hep virus through nationwide systematic approach that aligns with WHO's 2030 elimination goals. Sorry. Let me begin with why vertical transmission prevention is so critical globally. This slide shows that mother-to-child transmission causes about 1/3 to half of all HBV infections around the world. When infants acquire HBV at birth, 80 to 90 develop chronic infection. These infected infants face 15 to 25% lifetime risk for developing cirrhosis or liver cancer, causing around 800,000 deaths each year from HBV-related complications. However, this represents the most effective intervention point in the infection cycle with high success rates when proper protocols are implemented. WHO's 2030 elimination targets include 90% reduction in new chronic Hep B infections, 65% reduction in mortality, and maintaining surface antigen prevalence below 0.1% among children. To appreciate our current success, we must understand the situation Korea faced historically. The pre-intervention era was truly challenging. In the 1980s, about 11% of all Korean newborns became infected through vertical transmission, creating an enormous public health burden. This high vertical transmission rate resulted in elevated chronic Hep B prevalence throughout the Korean population, with weak hepatitis S surface antigen prevalence reaching about 8%. While universal vaccination began in 1992, it would take comprehensive systematic intervention to truly break this cycle of transmission. The breakthrough came with our national hepatitis B perinatal prevention program launched in July 2002. This comprehensive program represents South Korea's cornerstone strategy to eliminate mother-to-child transmission through systematic nation-level interventions. Our key objectives are clear: prevent vertical transmission of Hep B infection, reduce surface antigen prevalence in children under 10 years, and establish a robust nationwide vaccination and monitoring system. The program features 3 core components: universal screening with mandatory surface antigen testing for all pregnant women, immunoprophylaxis, combining Hep B immune globulin and timely vaccination, and systematic follow-up testing at 9 to 15 months after birth. The impact has been dramatic. Korea's comprehensive approach follows structured 4-step prevention protocol. First, prenatal screening with mandatory Hep B surface antigen testing identifies all surface antigen positive mothers before delivery. Second, Hep B immune globulin administration provides immediate passive immunity to exposed newborns within 24 hours of birth. Third, the Hep B vaccination series delivers active immunization through 3 doses at birth, 1 month, and 6 months of age. Finally, serological follow-up after birth confirms immunity through Hep B surface antigen and antibody testing. Let me share our remarkable statistical achievements. Mother-to-child transmission rate decreased dramatically from 4.1% at program inception to just 1% in 2021, representing a 76% reduction over 19 years. Among 230,000 mother-infant pairs enrolled in the program, about 154,000 pairs completed serological testing follow-up, demonstrating 67 follow-up completion. 67% follow completion. Among tested infants, only 3,620 cases were surface antigen positive, representing just 2.3 positivity rate and clearly demonstrating the effectiveness of our prevention program. For our highest risk population, we have achieved remarkable progress. Antiviral prophylaxis provides even greater protection. With antiviral therapy, mother-to-child transmission rate in e-antigen positive mothers drops to just 1% versus 6% without treatment. E-antigen positivity remains the strongest predictor of mother-to-child transmission risk, highlighting why targeted interventions for this specific high-risk group are so important. These results demonstrate that even our most challenging cases can achieve near elimination of transmission with appropriate interventions. Birth dose vaccination has been critical to our mother-to-child transmission elimination success. Korea's achievement of 93% birth dose coverage substantially exceeds global average. This performance directly impacts transmission risk. Our key vaccination indicators demonstrate comprehensive protection, 93% birth dose coverage, 97% 3-dose completion rate, and surface antigen prevalence below 0.1% in children. All metrics substantially outperforming international benchmarks. Program participant has been exceptional. About 96% of newborns born to surface antigen positive mothers participated in the program. About 86% of participating infants completed the full 3-dose vaccination series, establishing immunity in the vast majority of exposed infants and preventing chronic infection. This success has helped build population immunity. From 2000 to 2014, our program successfully protected nearly 181,000 infants, representing a truly transformational public health achievement that has broken the cycle of vertical transmission for entire generation of Korean children. Our pediatric outcomes demonstrate near elimination of vertical transmission. Happy surface antigen prevalence in children is already below 0.1%. Children aged 10 to 18 years show surface antigen positivity rates below 0.1% with 97% antibody positivity rates, indicating protective immunity. These achievements position Korea for WHO validation by 2025, having achieved generational protection that demonstrates the remarkable success of our program in protecting new generations from chronic Hep B infection. The introduction of antiviral therapy for high-risk pregnant women has significantly improved our prevention outcomes. WHO's 2020 guidelines recommend tenofovir prophylaxis from 28 weeks of pregnancy until delivery for pregnant women with high viral load or Hep B e antigen positive status. The effectiveness data are striking. Mother-to-child transmission reduction shows 0.9% transmission with antivirus versus 20.4% without antivirus. The safety profile is excellent. No serious adverse events have been observed in mothers or fetus, with meta-analysis confirming favorable safety throughout pregnancy. Let me explain our antiviral prophylaxis strategy following WHO guidelines. The target population includes pregnant women with high viral load over 200,000 IU per ml or HBE antigen positive status. The medication protocol uses tenofovir starting at 28 weeks of pregnancy and continuing until delivery. Safety evidence from systematic review and meta-analysis shows no serious adverse event to mother or fetus with odds ratio of 0.1 for preventing transmission. South Korea maintains exceptional high Hep B pediatric vaccination rates, reaching over 97% three-dose completion rate nationwide. In global context, this places us among the highest vaccination coverage rates globally, well above the WHO target of 90% for three-dose coverage by 2030. Comparing prevention metrics across the Asian Pacific highlights Korea's success. Korea leads with a 1% mother-to-child transmission rate, nearing WHO's 2030 goal of less than 0.1%. Korea's regional leadership includes being one of the few countries with structured mother-to-child transmission data monitoring, maintaining among the highest birth dose coverage, achieving below 0.1% surface antigen in pediatric population, and being referenced in WHO triple elimination guidance. Current age distribution shows significant prevalence remains in the older age group at approximately 3%, reflecting the legacy of high transmission before vaccination programs. The pre-1992 birth cohort impact creates ongoing population health burden due to absence of universal vaccination. Future projections indicate Hep B surface antigen prevalence will continue decreasing as high prevalence cohorts age, but this will persist for at least 30 more years. Chronic Hep B infection is responsible for about up to 80% of hepatocellular carcinoma cases in endemic regions like East Asia. Korea's successful program is projected to substantially decrease liver cancer incidence in future generations. Current legacy HBV infections in older adults will maintain HCC burden for more than 30 years, but near elimination of Hep B in children will dramatically reduce HCC incidence starting in near future. Despite our programmatic success, Korea faces challenges in achieving WHO elimination targets with specific policy gaps in key areas. Treatment access shows current treatment rate for eligible patients at 67% versus WHO target of 80%. Linkage to care shows only 40% of diagnosed chronic Hep B patients linked to care versus WHO target of over 90%. Mortality reduction shows annual liver-related mortality at 18.9 per 100,000. Critical policy areas include enhanced screening and referral systems for inborn population management, and so on. Several key challenges prevent Korea from fully achieving WHO's hepatitis C elimination targets. Persistent obstacles include overall population Hep B prevalence remain around 3%, elevated surface antigen rates in the older age group, uneven access to treatment and preventive services, and continued need for enhanced surveillance. This is my last slide. Korea's experience in nearly eliminating HBV mother-to-child transmission offers 4 key takeaways for global hepatitis elimination efforts. First, a national program scale out is both achievable and impactful. Government-backed systematic nationwide implementation delivers measurable results in transmission reduction. Second, a multi-pronged the approach is essential. No single intervention suffices. The combination of universal vaccination, universal screening, vaccination, immunoprophylaxis, antivirals when indicated, and systematic monitoring creates a comprehensive protection that dramatically exceeds the sum of individual components. Third, our systematic approach provides valuable insights for global hepatitis elimination efforts, particularly in high endemic regions facing similar challenges. Fourth, policy gaps can persist despite operational success. Success in preventing new infections must be complemented by addressing remaining challenges in treatment linkage, coverage, and special populations to achieve complete elimination goals. Thank you for your kind attention.